how much of our response in terms of leveraging technology and innovation
within the space of less than 2 months.
What is that likely to mean for the continent going forward?
The continent remains one of the least affected continents.
Africa needs a focus on a care that is accessible to all, integrated, appropriately financed, flexible, and also technologically enabled and sustainable.
So I just wanted to maybe reflect first on the responses that we have seen and what that means for governance on the continent. And I wanted to structure that reflection along two categories or two particular points. The first being the immediate response that we have seen, and the second is the follow-up response. I mean, from the point of view of the immediate response that we have seen, I think that we need to acknowledge and even positively assess, I would say, the immediate response that we have seen, in the sense that I think it was quite courageous, I would say, from the onset for the leadership to what I would qualify as depoliticizing the issue and conceding that there are serious limitations on the continent, that our health systems would not be ready to weather the heavy impact of COVID-19 as we've seen it, be it in China or in Italy and France at the time, which were the source, I would say, of infections of the continent. So we didn't see too much, I would say, political bickering as we would have expected on the point of leadership to say, no, since I came here, I've built X hospitals, etc. There was immediately that recognition of the need that we're simply not ready, and we need to limit the damage. And so what we've seen in that immediate response is that 94% of our countries introduced a lockdown when they had less than 100 cases. Even 50% of them when they had less than 10 cases, 10 infections. So I'll come back later on the issue of lockdowns in particular and what that means, and the repercussions that we've seen. But with the information that we had at the moment, that was the immediate response. And what we've also seen is that countries very quickly recognize that there are serious limits in terms of testing. I think when this entire crisis reached the continent, or the pandemic reached the continent, I believe we had only 3 laboratories, one in Senegal, Egypt and South Africa, that could test for COVID-19. That capacity was quickly brought up with the help of the African Center for Disease Control to 44 countries being able to test within the space of less than 2 months. So that recognition that the need to bring up that capacity, and I think that has paid back to some degree. I think the continent remains one of the least infected continents. I mean, I tend to be very skeptical about data on numbers of infections, but I think the numbers of deaths in particular give us quite a good indication in terms of the spread of the disease. And in that sense, Africa, I think the number of percentage of deaths, if I put that in the global context, represents 0.71%. Obviously, we'd prefer not to lose any life, but I think the damage has been seriously contained and limited as a result of early action. Now, the responses that we've seen later, I think then it's there where we start really seeing some of the structural limitations that we've had on the continent emerging. And obviously there has been a lot of, and rightly so, a lot of criticism on this decision to import lockdowns and how fit are they for African realities. The fact that a large percentage of our population, many of them living 70% working in the informal sector, really depend on revenue on a day-to-day basis. And so we would have liked to see a bit more proactive responses on the side of governments in the form, for instance, introducing new policies, introducing new interventions to try and cushion that impact. But what we have seen instead is that the structural issues that we've had in terms of our governance system, and by that I don't only mean political and political creativity and political leadership, but also the structural economic limitations that we have on the continent. And so unfortunately, the responses that followed were quite limited. I think we've seen few countries, for instance, introducing utility bill freezes, Ghana being one of them. In total, there are around 21 countries. 20 countries introduced cash transfer schemes to people, but that remains relatively small. I mean, we're talking of a bit more than just a third of the continent, and only 16 were providing food distribution. So in terms of cushioning that impact for the immediate needs, I mean, I'm talking really in terms of food to the population, I think most governments have fallen short of that. Now, if we look at, what kind of responses have we seen, policy thinking leadership on the continent to see how we can cushion this impact? Unfortunately, there again, we've seen serious limits. I mean, if I take a few examples, only 3 countries, for instance, introduced regulations to prevent employers from firing their employees. Only 2 countries, decided to create safer markets to allow the informal traders to carry on and still sell and have some revenue. And so this limited creativity, I would say, in terms of responding to the immediate socioeconomic needs of Africans and trying to really cushion the impact of the most vulnerable groups, was extremely weak, and it remains extremely weak. Now, what we have also seen on the political front, unfortunately, is that quite a number of countries continue, unfortunately, to see the current situation as an opportunity to crack down on opposition. Some of them, if I take my own country, Algeria, introduced new laws on fake news, supposedly, on how to, limiting the spread of fake news around COVID-19. But some of it then becomes, or parts of that law then becomes a tool to try and control political opponents, and particularly in a politically charged environment. So, I mean, looking at the responses, I think, to summarize it, what we've really seen is a lack of imaginative thinking in terms of responding to the needs of Africans, but also coupled with that, I think the weaknesses, structural weaknesses of our system was limited.
Thank you very much, Faten. I think that is a very good introduction to this conversation today, and the point you've made really around the limited creativity and the breadth of that across all issues. I think that in terms of the healthcare emergencies, we were very agile. However, we've not seen the same agility across various other sectors, and maybe that would lead me to the first question to you before I actually invite Bosun to also provide some perspectives from the technology and innovation angle. My question would be to first say, now, these structural limitations that you talked about are not new to us in Africa. These are things that we've grappled with over the years, and what we've seen is a lot of magnification, of those structural challenges with COVID-19. Do you think in any way that we are able, as a continent, to begin to look at the impact of this, at one level on state-society relations, the issue of social contract in itself, and how governments and themselves derive their legitimacy? Do you think that the response to the COVID-19 challenge in a way has challenged the African understanding or the African reflect how this has manifested on the continent over the last few decades and all of that. For me, that would be the first question. The second really will be to sort of look at, like you mentioned, the impact of this is not just on health. It's on economy, it is political, and the rest of it. What do you perceive as some kind of political challenges that we should be paying attention to beyond, of course, and I don't say because it's not necessary, but beyond the human rights issues that we're seeing, what other political dynamics is this likely to create for us going forward? I would like you to respond to that very briefly so that I can invite Boso. Thank you.
On the issue of state-society relations, I think we've known for a long time that that's really the core issue when we speak of governance on the continent. And I think it has manifested itself during this crisis yet again. I mean, if I look at the issue of a lot of our countries have struggled with imposing lockdowns, for instance. And part of that relates to the trust, I would say, that people have in the information that the government is providing them in terms of the risks associated to COVID-19. So you do see people, I mean, again, particularly in politically charged contexts, and with the spread of fake news, where people then start questioning the information that, that can be correct, but because it comes from the state, it doesn't hold that legitimacy. And I would argue, actually, that this is not, in this particular case, specific to Africa. I mean, to be honest, we do see it in the United States, and we do see it elsewhere in the world. So I think it's partially there is the issue of, the fact that we're dealing with something that we don't necessarily know, but that is really compounded by this tension in terms of state-society relations. So I think it just shows us that we need to go further. Now, it has obviously implications politically later on, besides indeed the issues of human rights. And I'm thinking particularly on along the lines of 3-4 issues, which we are already seeing some challenges emerging in that respect. The first is, as you're aware, some of our countries are seeking debt relief or even borrowing money from international institutions to cushion the impact of COVID-19. And what we're already seeing are question marks being raised across the continent as to whether that is the right strategy. Often it's not, I would say, informed by, an analysis of what kind of loans will our government get or not, etc. But really from this history of a lack of trust on whether our governments are taking the right decision and whether they would use that money wisely. And I think that debate will only take more shape and more space even in the public discourse as we move along. The second point is the fact that inevitably every single economy on the continent in the world will be affected. And so the governments will need to introduce some type of reforms. But again, because of this lack of trust, whatever reform will come will be challenged. I'll take the case, for instance, of countries where there are heavy subsidies of certain products, be it oil for oil-rich countries, be it subsidy for food, staple food, etc. And you see some countries now starting to play around with this idea of removing these subsidies. The impact of lifting or removing those subsidies on people is direct, and politically can result to very volatile situations. Now, couple that with this lack of trust in the ability of our governments to manage transitions, manage change. I think, to be honest, I'm rather skeptical in terms of whether on the continent we will keep a certain level of political stability. I do suspect that we will see even higher levels of popular contestation across the continent. It will worsen the situation where there were already political contestations. Now, the third issue I'd like to highlight, and that's particular to some of our countries, I mean Algeria, Nigeria, Angola, etc., is the shock in the oil market. State revenue would be extremely limited, and so the space, I would say, that a lot of these countries had to buy social peace or the financial space will no longer be available to them to do that. And so what we will be most likely seeing is, again, more questions being asked from the population, more political contestation. And so I think we will go through a very delicate period politically, even further, stimulated by the impact that COVID-19 will bring, where people will start probably demanding more, questioning more the responses of government. And as long as you do not have that legitimacy, that people do not feel that you are legitimate where you are, as a leader, as a government, as a political party, it's very difficult to even introduce some reforms and take a country with you even when they are necessary. And so I think those are the kind of debates that we will be seeing from a political point of view on the continent as we move along.
Oh, and that is a very interesting point that you've made in terms of the challenge of implementing some of these reforms or introducing these reforms that is very much required to take Africa out of the challenges that we'll be facing. I think this is the time to now switch, and I'll come back to you because we will then begin to take questions and reflect further on some of the issues we have raised. But now I'd like to invite Bosun Tijani. Bosun would be sharing with us his perspectives around the preparedness of the continent, so to say, digitally. How much of our response in terms of leveraging technology and innovation have we seen, and what is that likely to mean for the continent going forward? A lot of people have talked about the future of technological progress in Africa, and COVID-19 as an accelerator of that. I would like you to take the floor and share your perspectives on these, Bosun. Please, you have the floor.
Thank you, Ibrahim, and I think thank you to everyone for joining this webinar as well. If I look at the title, I think what excites me about the webinar is the title itself, which is Africa's youth and COVID-19. I think, without even going beyond that, just the fact that this is about Africa's youth, which literally for those who follow the reality of the continent, that the future of this continent is the young people. I think Africa is a continent that in itself has been at a disadvantage point on so many levels, even in terms of our preparedness for a pandemic of this sort. There's been all sorts of narratives around how we've managed the pandemic. I personally tend to try to stay out of any conversation around trying to judge our performance in terms of how we've managed the pandemic, because I think most of those conversations are likely void of data and evidence. I don't think we have enough evidence to demonstrate that there's been thoughtfulness in the way the pandemic has been managed in Africa. I think the jury is still out. There's also not enough research to help explain why we're not seeing as much debt as other continents are seeing. I think it may be much more, and my assumption is that it's way much more than the approach that we've taken. We've seen exemplary leadership in a number of countries, like Rwanda. I think South Africa has also been adjudged to have done a fantastic job in the way they've managed. In quite a number of the countries, the number of tests we're doing is nothing to write home about. So if you don't test, you don't know. In my country, like Nigeria, for instance, we've been hearing of deaths that are not also attributed to COVID. So it's impossible for us to ascertain whether those deaths are linked to COVID or not. But I think when we put all that aside, one thing I think Fatih mentioned, which is quite strong, is in the total overall number of deaths. I think that this is where no one can really make a judgment yet. We've not seen any crazy number on the continent, which means we're not being hit as much as other continents are being hit. A couple of weeks ago, there were assumptions that the pandemic or the virus was late to Africa. I think we've now again seen many weeks after that assumption, and still we're still yet to see the death level at the stage where one would say that we failed on the continent. But what does this mean for innovation? If I go straight into my intervention, what does it mean for innovation? I think what we can already see is the fact that we've not given enough attention to the role of innovation and technology in society even before the pandemic. And that's why we've struggled in a way to actually be able to meet the needs of our people. In the first place, some of the things Fatih talked about, in terms of how government responded, how government provided support, even in the health system itself, how the health care system in most of the countries use data, to determine where they put the right intervention. You can tell in some of the countries we didn't even have enough beds if people were to go into isolation centers, and we had to start building significantly. Of course, even countries like UK had to build, but they had to build when the numbers started becoming unbearable. So I think from an innovation point of view, we struggled. But the way I've been looking at this, and which is more looking towards the future for young people, is twofold. One is, what role can innovation and technology play whilst we're still in the pandemic? I think that's the first thing I find absolutely important. And what role will innovation and technology play post the pandemic? Because these two things may look simple, but the implication of the pandemic on the reality of these two things will determine where we go as a people. In terms of within the pandemic, we still have the opportunity for us to quickly accelerate a number of innovations, some of them in communications. How do we do last mile communication to ensure that all our people in different parts of the continent are well informed? Because we still need to bear in mind that there's a ton of people on the continent who believe that coronavirus is being made up and it's nothing real. So how do we get the right information across to people using innovation? How do we use innovation to even get supplies to people, families that are being locked down, families that have been affected by the economic implication of the pandemic? How do we support them? How can governments use the minimal resources that they have to support these people? This in itself will require significant innovation that I think we're still shying away from. And we need to figure out a way. It's not enough for government to say that companies can't fire. You can pass the law that restricts you from firing people. But the reality is that if a company cannot continue to sustain its employee pool, they will have to fire, and there's nothing any government can do about it, because that company may even go bust eventually. So we need to be somewhat innovative around how we manage that as well. What are some of the unique ways of doing that in our own context, not necessarily just borrowing from how it's been done in the West? I think there's massive opportunity in that space as well. Immediate threat that we've also seen is in supplies. Even as nations are now saying, for us to flatten the curve, we need more people to wear masks when they go out. And we know that the bulk of the masks that the world uses comes from Asia. And now Asia is inundated. Asia can't supply the entire world a lot of the PPEs that is required. And these are things that we can make locally. And we've seen the ingenuity of our people in making this product. But the challenge is still that these products are not meeting the standard that is required. It's not enough for you to just cut African fabric and you hand it to people. Yeah, it might do some level of protection in terms of basic everyday use, but how can we bring innovation to the table to help some of the manufacturers upgrade their production techniques to a level where the product that they produce is actually the quality that we need to see? It's not rocket science. Again, I don't think the effort in that area is already strong enough, and those are some of the things that we need to start to consider. But on the second part of my intervention, which is more post-COVID, I think, Ibrahim, you mentioned it, that COVID is an accelerator. It sounds simple in reality, but it's actually a threat to our continent. It's a threat in the sense that we've not invested enough in the resources that we required to leapfrog innovation on the continent. And what COVID is making happen is that over the last 10 to 15 years, there's been a lot of development in technology, advancement in connectivity, in how we collect and use data, in automation, in robotics. All these advancements been looking around, waiting for ways of applications that government and people have pushed back on. And what you've seen with COVID is that the world became almost like a laboratory for all this technology. I'm sure there'll be people on this call that before COVID never used Zoom. Zoom had just about 10 million daily users, sometimes in February or January. As at the end of February into March, they had gone up to like 20 million daily users. I'm sure it's way much more than that today. That's the sort of acceleration that we're seeing in technology. So digital solutions will definitely come to become a major part of our world as we move forward. You've seen it being used strongly in education, where parents now literally dump their kids in front of a laptop and they're speaking to a teacher somewhere, or they're watching a video on YouTube to learn. All these things are fantastic, but they also have implications as well. They have implications in terms of privacy on one hand, but they also have implications in terms of the competitiveness of nations. As we continue to build, where is our solutions coming from? How much of what we consume are we building on the continent? This is actually going to become the major challenge that we have to deal with after COVID, because a lot of the tools that we're consuming are not from the continent. So there's an implication for that on one hand. On the second hand is that some of the critical solutions that we need from a digital point of view will not be available because we've not invested enough in them. And the foreign entrepreneurs and foreign companies may not build those solutions for us. Of course, we can use Netflix, we can use Google, we can use Uber, but where are we going to find our own Tesco delivery option in Lagos or in Cairo, for instance? Tesco is not going to come to Nigeria to build that, but who's going to build the real food delivery system that get food from one point to the other if this becomes the new normal, which is going to affect society? Because whatever we do, we need to take into consideration that with COVID, probably the rest of the year there'll be panic in society. The way people live will change, right? We've seen some companies who are now choosing to say they're not going to go back to their offices. Their employees will totally work from home because they don't see the need for it. Because the fear is still there that if you open up the offices, people might start infecting one another. But even without the offices, people are functioning really well and people are performing. So why incur the cost of an office in the first place? So I think for the African youth, as I begin to wrap up, for the African youth, for me, what I think is extremely important is that we see the need for us to be part of a generation of people that needs to build for the continent. There's a need for us to accelerate how quickly we're building solutions. And not only are we building these solutions because there's an opportunity for us to generate revenue from it or gains from it, but that we're building solutions that can actually solve significant problems in the society for the people. If we don't build it, the world has gone past the stage where everyone can outsource the production of literally everything to China. Even if China is willing, it's just impossible for the world now to rely on China. And that's one lesson that the world has learned from this pandemic. And as such, innovation will be important. How we support innovation will be important. Digital solutions will be a major part of how we live. So the need for us to build intentionally, build solutions that are tailored to the real needs of our people will be amplified. And I believe it's the young people of the continent that can help Africa, meet up with that demand. Whatever we want to say about our politicians, we need to understand that there's a disconnect. There's a price for electing people based on biases. And this is going to become more amplified, right? The biases that we have, the affiliations that we have, that determines who we vote for, is going to become more amplified, because the world today will demand from us people with credibility and know-how, right? You can see in countries like Nigeria where the whole price is falling. Literally, the country is at the moment not making any significant revenue. So it's not going to be enough whether politicians get to power. The questions we'll be asking is, who are the people that can deliver what the society requires? And I think the young people of the continent are those that will need to step up to save the continent and save the future of the continent as well. Thank you, Brian.
Thank you very much, Bosun, for the insightful contribution. One point that stood out for me was the point that you made about our level of consumption of these global technologies and innovation, and how Africa in itself should begin to reflect on what it contributes in terms of developing its own solutions that addresses its challenges. Do you think that policy, broadly on the continent, or you can give specific examples of where you probably think that those individual countries are doing very well in developing, local solutions, so to say, but also to then link that to your last comment about, elections and biases. I know you're a fellow of the Stanford Democracy and Development Program. So this is also an area that you're eminently qualified in. The question is, do you think that our governance system, as currently structured, in any way is imaginative enough to drive the kind of reforms that we want to see in technology and innovation going forward?
So those are difficult questions. You see the way I almost blocked through the elements of my presentation on the one on democracy. I intentionally didn't want to go deep in there because it's a complex conversation. But the question you're asking in terms of readiness of governance to deal with some of this, I think the direct answer is no, because there's a huge problem in governance in Africa, and that the problem is the disconnect between government and governance, and the misunderstanding of government and governance. Governance, to the best of my understanding, and this has been well described, it's not just the sole responsibility of government, but both government, citizens, civil society organizations, and some of the smartest entities, including private sector organizations. The combination of all these entities coming together to work together to deliver public goods and services is what leads to good governance, right? It's not just the sole responsibility of government. But in a lot of African countries, what you find is that politicians see politics and government to be the same. The reason why they compete is to get access to everything that comes from government. And everyone that supports politicians in that sense support for now because of government, not because of governance. So the bulk of the work that we're still missing then is that totality of people taking decision based on what does a party A bring to the table that influences good governance in the country. And that will start taking us to conversations around manifesto, for instance. If I'm electing and voting for someone, I'm doing so based on their manifesto. Do you have something to say, Brian?
No. You blacked out on my side for a few minutes.
Oh, okay. So if I'm voting for someone, for instance, am I doing so because I believe in the ideology of the party and I believe in the manifesto that the person is putting on the table that is going to be able to contribute to governance? That's not been the case in a lot of the countries. And because that's not been the case, what we end up doing is having a government that is totally disconnected and unable to strategically contribute to good governance in most of our countries. even if when they get in there and they realize that as leaders, we have to do something, the foundation for them to thoroughly contribute is missing. And because the foundation is missing, and this answers your first question as well, you then begin to see that intention is not enough. The ability to implement policies, again, this is where I think policies are never enough, right? If you look into most of our countries, I don't think what we have is lack of policies, by the way. Of course, policies you can always improve upon, but most of our countries get support to draft the right policies for innovation, for technology, for entrepreneurship, for healthcare, whatever you can think of. They copy models from abroad. They get consultants. There are consultants across Africa working with a lot of these government entities to drive the right policies. But policy in itself is not what brings about innovation or change in a society. It's the implementation and the courage to act, the courage to act. There's a question I've been asking in Nigeria, for instance, since this started, and it's probably the same for most countries in Africa. What does it take for a lot of African countries to zero-rate education technology apps? So apps that can help kids learn whilst they are at home. What does it take to zero-rate it? By zero-rating, it means that you're working with the telcos to make it accessible to people for free. So if you're from a family where your parents can afford to buy data plan, but you have a simple device, when you connect to those apps, you don't have to pay for them. You don't need data to be able to use those apps. At a time like this, when kids are not learning, what does it take for that to happen? It's not policy, it's courage. The courage, the belief, the understanding that if we unlock this, it's going to affect many, many more people. And I think this is what gets in the way of innovation on the continent. We do not have the courage, and it's because there's a huge disconnection in the framework around governance on the continent. Politicians are politicians. They're in power for government. They're not necessarily there for good governance. They might change their mind in the middle and say, let's do something for the people. But it takes much more than wanting to do something for the people. It takes the courage, the drive to make those things happen. Those little effort needs to happen. If you're talking about innovation, what's the role of our universities? What's the role of young people? How do we empower the smartest of people amongst us? If someone creates an innovation today that can help solve a problem around COVID, can we accelerate that innovation quickly, even if I don't know the founder or the inventor? But can I accelerate that innovation because I know the people who benefit from it? I don't know if the answer is yes in most Africa.
Yeah, interesting perspectives, Boson. We already have quite a lot of questions, and I'm sure you and Faten can already see them. There has been a question on the issue of elections, Faten. What does this mean for elections? Ethiopian government just recently, I think actually over the next few days, we would have to revise its electoral calendar because of the COVID pandemic. There are several other countries that would likely go through similar challenges. What do you think is an implication of these going forward for governance issues? And I think Boson already spoke about a few of those. And to Boson, there has been quite a lot of questions around, one, the cost of connectivity on the continent. What is the government doing in terms of increasing last mile connectivity across the continent? There's also the discussion around the impact of the emerging digital economy on the informal sector. And I think that that's a very important question that has been asked. Someone talked about, the inability to have a lockdown in a situation, and I think Fatin already mentioned it earlier, where you have 70% of your labor in the informal sector, and what that means in terms of, relaxing the lockdowns and the potential impact on the increase in cases as well. Someone also wanted to check with Boson on the issue of non-profits, particularly those working on issue of technology and innovation. That what role can they play in terms of driving a development reform for the continent in the area of entrepreneurship, particularly? I think that those are, quite a few questions that we can take at the moment. and then we will then move to the second aspect, and then we can then have a wrap up. So Faten, you have the floor to respond to a few of these questions. Thank you.
Yeah, thank you. On the issue of elections, I think there are quite a number, well, I would say two key issues. The first one is, I mean, you mentioned the case of Ethiopia. The issue of constitutionality there was of particular concern. And I think for quite a number of our countries, particularly where we are moving towards the end of the legal term, oftentimes, you know, our electoral laws might not have catered necessarily for these, you know, type of situations. So I think there is a question really that has to be looked at country per country as to what it means for the constitutionality of, you know, extending the current president or the current Prime Minister's term. The other issue is, what does it mean in terms of influencing the thinking of electorates? And there I'm not too convinced or hopeful that the current situation will fully, you know, introduce a full radical change in one direction or another in terms of how the electorate sees it. And that's largely because I think the political landscape in Africa remains generally underdeveloped. I think Bosun said it also. You know, a lot of people still vote along, you know, based on certain biases, etc. And I think that will remain. I doubt that COVID will change that. I think that type of change will only take place in, you know, over a longer period of time. But also, I think the supply side for voters in terms of, you know, do we have political? I think we have a crisis of creative politicians on the continent, you know, be it in leadership or opposition. I think generally we've seen as poor, as limited creativity on the part of opposition as it is on parts of some governments, and, you know, coming up with new, you know, with exciting solutions on how to handle the situation. So I think with that limited, you know, political creativity, I think we might actually see a bit more of the usual. I'm more skeptical on that front.
More of the usual and a bit of skepticism on our governance system changing significantly going forward. Bosun, your response on the questions.
So you know, interesting question, and I think I can draw on something I saw yesterday to almost answer all the three questions. Like, you know, so what can we do about connectivity? The reality is that connectivity is expensive, right? If you look at a country like Nigeria, we actually do have a significant capacity in terms of broadband on the continent, or also in the country rather. You know, I think we have about 3 companies, main one cable company, I think Glo, also it's called Glo One or something. MTN also has capacity. So this capacity came all the way on the sea from, you know, places like Portugal, by the way. So significant investment is gone into getting broadband into the country. But the biggest challenge that we still have is in getting them through to the people. So how do you take it from the sea and make sure that it's everywhere in the country? And that in itself, it's an economic challenge. It's an economic challenge. I still remember when we tried to put fiber in the technology cluster in Yaba in Lagos, for instance, and we went to Main One because when we started CC up 10 years ago, we were using microwave technology, which meant whenever the weather was poor, the quality of internet will be down. So we spoke to Main One cable company, and some of the challenge they faced was it was going to cost them, I think, close to $3 to $4 million, if not more, dollars to get the fiber cable into Yaba and surrounding, even though the cable was already in Lagos. And they didn't see the amount of business that they could do that will pay for that investment in that neighborhood. But what we had to do was to work with the then Lagos state government, Fashola, to give them the right of way for free. So the government took out the charges. I think it was about $1.something million that they would have needed to pay to the government to be able to lay the cable. And the government took that away, and they were able to lay that fiber in Yaba. And today, that's what led to Yaba. For those in technology that may hear the talk of Yaba as a technology cluster in Nigeria. So it takes a lot of, again, this is almost coming back to courage, but it's easy to say courage, I guess, but it's expensive to do. And government will need to see that this is tied to our future and to our economy for the investment to happen, because it's going to be strategic investment. And the experience I had yesterday that I mentioned at the beginning was that of Rwanda. Actually, I was on a call yesterday where Rwanda now have something they call the Digital Inclusion Council. And I was surprised to see the approach. So the Digital Inclusion Council, from the perspective of Rwanda, is to say that, you know, digital solutions and technology is going to become how we live our lives in the future. And for companies to be able to help make this happen in Rwanda, we need to make sure that, one, there's access, our people have access to the internet, because without the internet, a lot of digital solutions will be impossible. That, two, that we can educate a lot of our people for them to be able to become people who can consume digital solutions, because there are a lot of these solutions that you can't consume if you don't have basic education, right? And the third element is, if the companies don't have the right policies and investments in place, they won't be able to innovate to make it happen. I thought that was a smart way to look at the pandemic, you know, and what's going to happen after it. We can talk about how beautiful it is, but some of these questions speaks to some of the challenges that we're going to face, even if we want to go digital. The second question, which is around the emerging digital economy and the informal sector. What do you do about that if everybody is going digital? We are a nation in most of our countries where the informal sector is heavy. A lot of the people within this sector are probably not educated. Those that are educated don't have access to technology. They don't know how to participate in digital economy. There's going to be a need for us to train and enlighten people at scale. And it may sound inundated, like, how do you take up all of that? You know, we may sound like we can't take up as much work if just to get people on digital. But the reality is that we can't avoid, to have people that are being left behind, right? We can't afford to have people that are being left behind. And it's the same for non-profit as well. So if non-profit will get involved into this, if you talk about, non-profit participating in the development of reform, what reform are we talking about? Because it's okay to, again, put the policies in place, to talk about the policies in place. But I think the engagement from non-profit can actually be more around inclusion. How can non-profit organizations help to ensure that those that are being excluded are being included? The example I gave on education, for instance, is also a strong one. Those parents with access to data plan, with access to all the gadgets in the world, are making sure that their kids are still learning one way or the other. But the families without, who are excluded, don't have the opportunity to learn. And that's why I think the Rwanda approach is one strong way to look at this, which is digital inclusion. The concept of digital inclusion itself will need to become the center of attention for a lot of government and stakeholders in this space. As we're forced to move to digital, how do we ensure that the bulk of our people are not being excluded? And it's a good thing to do. We're not doing it because it's just good and we don't want to leave people behind. It's good for business as well, because when you build the market, when you include more people, then you have more people who are willing to consume digital solutions, which means when we build these digital solutions, the market and pool for them is also larger. It's almost like when you look at China, where WeChat in China, for instance, is extremely powerful. You can get married on WeChat. You can get a divorce on WeChat. Payment, there's some part, I was in Wuhan, sometimes in summer last year, and you couldn't even pay. Sorry, not in Wuhan, in Shenzhen. Yeah, I was in Shenzhen in summer last year, and you couldn't even make payments, without having the payment option on WeChat. So I had to transfer money to someone on PayPal then for them to get me cash and things like that. That's how well integrated it is. And those solutions are successful because the government is invested in the infrastructure, but also in the ability to include more people into it. So I think a lot of these three questions that were mentioned, in my opinion, I will approach them from a digital inclusion perspective. to say, what do we need to do to include more people in the digital economy?
No, thank you very much, Bosun. Digital inclusion as a key policy reform on the continent is the point that you're making. As we try to close this section of the conversation, and I say close advisedly because we would have to release Bosun, I think, in the next few minutes, but Fatan is still with us and we can have a broader conversation as governance links to economy and the health sector. But for the two of you, as we close this section, I wanted to ask you, because I've seen quite a few questions here or comments, one from Samson Itodo and one from Ibrahim Farouk, both of them talking about, one, how do we improve innovation and commitment within our public service by introducing young people, because gerontocrats have the courage to maintain status quo, but maybe new folks getting into the fold might be more imaginative. Ibrahim Farouk is saying we definitely need to deal with the leadership selection, a deliberate leadership selection process. And my question to that, to the two of you really on this is, what is the space for intergenerational leadership and, intergenerational, but also in a way inclusive in terms of all the other groups, women, youth, people with disabilities and other vulnerable groups. What is the space for these individuals, these groups of people, to be able to engage the governance process post-COVID-19? Do you think that COVID-19 has helped in a way make a case, for this group of people who oftentimes we claim are more imaginative and maybe more transformative or innovative in their approaches to governance, to now begin to engage this process? Faten, do you think that now is an opportunity, or you think that it's also going to take time and not necessarily because COVID-19? I would like to have your reflections on that.
It may take time, but it doesn't mean that now is not the opportunity. I think what COVID-19 does is that it turned our world, I would say, upside down, in the sense that governments are forced. They have no other choice. I keep on saying that, some of our governments, for instance, still depended on aid, or for them, when they think of development, they think, how can we secure more development aid? And I think even that is now, it's going to be so insignificant that it won't be able to respond to the transformational needs that we have on the continent. And so I think that, combined with the likely tensions that we will see politically, but also economically on the continent, I think there is, now is the time. Now is the time to say, we need to completely go and rethink our governance system on the continent. And there, I think the intergenerational dialogue and a more inclusive type of system will need to be part of the picture. So I think that find is necessary. But the reason I'm saying it will take time is that as we have them now, our systems are do not enable or do not provide necessarily space for young people, to start even lower and go up. I'm a big fan of the work of the campaign of Not Too Young to Run, specifically for that reason. I think we need to start very early on, because the truth is that ideas are fantastic, but government is a business in itself, and so you need to get people to get a feel of how that works. The entire negotiation skills in that entire system is not something that everybody is talented to do. Some people are, but most people would need that training to get there, and so providing, starting to think about how do we, what we had won't work. I think that's very clear. I think the safety nets that our governments thought they had, they won't have. I'm talking, for instance, in terms of development aid. So they will need to go and think differently. And I think now is really the opportunity for the youth to ask and impose that agenda of inclusion.
Thank you very much, Faten. Very important points you've made. Bosun, your comment on this before we move on.
And I think just almost in the same line as Faten is shared is really the fact that the dynamics of the global economy in itself will change, significantly after COVID. A lot of the nations that we look up to for heads would also have their own internal crisis to battle with. You can see the UK, for instance, bailing out the economy on so many levels. A lot of the ways in which we traditionally generate the little revenue that we generate would also, they're also being affected. So the order of the global economy in itself will shift slightly. I think the reality though is that I don't expect much gains from the pandemic for Africa. I think that's the honest truth about how I feel. I don't think the pandemic in itself is not hit us hard enough for our people to wake up and realize that they need to change the way they select the people they select to lead them. I don't think that's happened. And because of that, it will take a while for government to start to shift to competency as against just, selecting patriots, people that are patriotic to a party or to a political leader. It will take a while. But I think we also see the examples, though. The little gains are in places where most of the African CDCs, and when I mean African CDC, like the CDCs within different countries, those with the right people at the head, they can tell the difference in approach to the countries without the right people. So we've seen there how selecting the right people for the right job is becoming more important. And I think what we'll start to see as well is in the digital economy. As digital economy becomes more important, it will be important to have the right people leading the charge in those areas. And you're going to see countries start looking towards merit. And once we start seeing that, I think what you notice is the young people we're talking about and the creative people, the marginalized people within the society, women, you start to see more people, because those are places where we have the creativity and talent that we need to leapfrog development in Africa that we've not thoroughly used. But in terms of timeline, I think this may take another 5 to 10 years before we start to see significant gains. Because what will happen is immediately after the pandemic, there will be bailout funds that will take government back to business as usual. But those funds will not last for 2 years, for 3 years. And the pains will start to come. Once the pains start to come, I think that shift we may start to notice the shift on the continent. But again, all this is assumption, right? No one knows what the future of the world is going to look like post-pandemic. We're all projecting.
Thank you very much, Bosun. And it's been very useful having your perspectives on this issue. We would now move to the second section of this conversation, and we would be having Gugu Nonjige, whom I've earlier introduced, share our perspectives with us on Africa's health system. How do we reimagine Africa's health system post-COVID-19? Gugu, if you're here with us, let's start this conversation by asking you, beyond COVID-19, do you think that this crisis in itself has created an opportunity for us to begin to look more closely at our health systems in Africa? Gugu, you have the floor.
Hi, everyone. Thank you so much for inviting me, and thank you so much for the opportunity to kind of present. More than anything, as you've mentioned, I'll be speaking on reimagining Africa's health systems. And I think more than anything, before the current coronavirus pandemic, started to impact the continent's potential ability to even deliver the initially forecasted significant peak demand on our healthcare services. It's no secret that the healthcare sector in our continent was already facing several acute challenges, right? The healthcare sector alone has been experiencing significant and complex issues for some time now. So those are ranging from aging assets, effective delivery of services to regional, remote, or even disadvantaged communities. And also, even when we're looking at the Afrobarometer data from our side, like the new analysis from our survey that was conducted between 2016 and 2018 shows that more than half of Africans go without needed medical care, at least once in a given year. The data further shows that across the continent, citizens have identified healthcare as the most important national problem that their respective governments needs to address. And even before the threat of the overwhelming demand due to COVID-19 or even the pandemic itself, about 1 in 5 Africans faced a frequent lack of needed healthcare services, including almost 2/3 of the poorest citizens in Africa. So that kind of gives us an idea what has been happening even before we were faced with the pandemic in our respective countries, but also across the 34 countries that we work in as Afrobarometer. And I think that now more than ever, in collaboration with communities, healthcare workers, and all stakeholders, our continent and our respective countries need to reimagine the way it delivers healthcare services so as to cater for the new paradigm it's currently facing. This also involves critically thinking holistically across the whole value chain of healthcare service delivery, from strategy to implementations of changes to the physical environment in which healthcare services are being delivered in Africa. Overall, I do think that Africa needs a focus on a patient-centered approach, or even a patient-centered care that is accessible to all, integrated, appropriately financed, flexible, and also technologically enabled and sustainable in the long term. It is no secret that we are living in the age of the 4IR. So now's the time for Africa to start incorporating some of these technological changes in its responses. Again, it is also clear that the outcry in virtually every country about the lack of equipment and supplies to test for and to even protect against the COVID-19 will lead countries to re-examine their supply chains and procurement management processes for critical health and the livelihood related services that they provide. This, of course, will lead to a surge of nationalism with respect to the need to produce pharmaceuticals, medical supplies, and equipment domestically within their respective countries. This is also including even countries that traditionally had no capability in these areas. Will also allow them to seek to develop the same, similarly to those countries who've already been doing. Also, in looking ahead, I think more than anything, crises do create a burning platform for change and innovation. And COVID-19 is providing the perfect storm to reimagine healthcare design and, of course, delivery in Africa. While we are focused on the immediate issues in our communities, once we emerge from the crisis, there will be an opportunity for us as different countries to reflect, to recalibrate, and redesign our healthcare delivery for the future. In recalibrating and redesigning our healthcare services across Africa, we should also invite generational, which is Africa's opportunity to harness its critical youth demographic and, of course, geographical contribution. So now's the time for us to actually make sure that our approach is intersectional so much that it includes the youth. It also touches on areas that enhance participation by young women or even women in general in providing all these services. Again, I want us to look into Africa to look into accelerating its technological uptake, right? The COVID-19 pandemic will transform the healthcare community's acceptance and use of digital health technologies, right? As health care services, or rather even healthcare systems around the world, are overwhelmed with responding to the pandemic, while continuing to provide healthcare services, leaders across the globe or even across the world are adopting technologies that only 3 months ago were on the sidelines of healthcare systems. And now's the time for Africa to start looking at those, right? As doctors, patients, and again, home care providers turn to telemedicine to reduce exposure to COVID-19, they're also discovering these virtual consultations medications that are even effective to try and gain care, sharing critical guidance, and also even providing emotional support. This should also pressure government in Africa to accelerate electricity supply. Our Afrobarometer data conducted across 34 countries in Africa show that only about 4 in 10 homes in Africa enjoy a reliable electricity supply. So this is something also that we also need to start looking into, the infrastructure that will enable our governments to fast track the providing of adequate healthcare systems. We also need to bottle down to the type of infrastructure that we currently have. This is also including the Internet of Things as well. In continuation, again, dashboards for logistic management systems are also providing the efficient deployment of essential resources in some countries, from hospital beds to PPE to ultimately vaccines, right? And more advanced technologies, including artificial intelligence, are being deployed to provide insights into complex questions of how individual behaviors in our respective countries impact these transmissions of COVID-19, and even identifying which policies are effective for specific marginalized groups. As we can imagine, that things are not necessarily the same in different various groups, from age to gender to even other different social demographics. And again, as the saying goes, you can't put the guinea back in the bottle. Once deployed, the use of these technologies will only expand as we revert back to solving the challenges, problems that preoccupied us even before we were challenged or even faced with COVID-19. Having too few health personnel and inadequate budgets and weak healthcare systems. Maybe again, these technologies will be what helps us get closer to our shared goal of universal health coverage across Africa. Another thing that I'd also want us to put forward in this conversation is a return to community-based models, right? National governments must reconnect to the truth that any public health crisis will only be mastered with communities at the center. It will only be mastered by harnessing their most prevalent and their most active demographics, which is the young people, those who are also in the front lines. It is no lie that majority of the people who are in the healthcare sector are women in Africa. So it also lies within our national government to reconnect to that and also utilize those and making sure they put their skills into place. Again, young people in Africa, again, recognized as agents of change and an important resource in mitigating the COVID-19 risk and community outreach in respective countries. However, they can naturally contribute to the spread of the pandemic if not properly sensitized. And that's something that we need to keep at the back of our minds. Again, this is a key consideration in context to a population density and social cultural fabrics challenge the effectiveness of preventative measures, such as social distancing, and where the social health system profile is unable to cope with higher prevalence of existing endemic diseases. So in this view, investing in every resource available in fighting the spread of COVID-19 is essential. So is a demographic dividend, which is the young people in Africa of the continent are, again, a really critical asset in challenging this. Thank you.
Thank you very much, Gugu, for your presentation. I mean, I know that a lot of people wanted you to slow down a bit, but I thought that, of course, when we begin to take the questions and interaction, we would get into some of the very important points you made. You talked about the patient-centered approach, inclusivity in the design of these policies, the issue of community-based models, which we have seen as maybe a very important place for us to deepen the reforms on health issues. You talked about finances, technology, and of course the intersectional issues that we have to pay attention to. One quick question before I invite Tessa to give us the broader economic implication of what we are saying. And the question really is about one of the structural challenges that we've faced on the continent and the health sector as regards brain drain. If you look at many of the efforts globally all over the world that we're seeing today, many Africans are in the center of those efforts, whether they are medical doctors or epidemiologists or even researchers globally. How do you think, and many of these are young people, young men and women from the African continent who are contributing to the global response. How do you think that, one, on the continent, we are responsive to the needs of those who are working on the continent? And I think that that's a point to make. You know, how responsive have we been to the needs? We've seen many countries now already passing laws to give special allowances to health workers. Why did we have to wait till now? We're seeing countries saying, oh, for health workers, maybe they should not pay taxes and all of that. Is this not another example of reforms that should have predated COVID-19, that now COVID-19 is helping us, you know, pay a lot of attention to it? Now, how do we sustain this? So for those who are on the ground here, what are we doing to attend to their needs? And the second point is, how do we then begin to deepen the reforms in our health sector to bring back, in a way, for at least for those who are willingly want to come back, to be able to then contribute to our health services sector on the continent? I like your perspectives on that.
Okay, thank you so much. So I kind of like wrap those two questions into one. More than anything, I do think that the pandemic has given time for Africa and even our respective countries to kind of introspect and kind of look at the available services that they've been offering their citizens. So for example, you mentioned that various countries have offered some sort of relief grants for those who are at home, for those who are unemployed. And if whether this is something we could have been doing even before the pandemic. Our Afrobarometer data, for example, has kind of shown us when we're looking at the most important problems to Africans, unemployment is rated about majority of them, but 40% of Africans actually rate unemployment as a top priority for their governments to address, followed by healthcare, 27% of only Africans noting it. Things, or not even things like social issues, like for example, corruption, crime and security fall way below the line. So I think in governments addressing some of these issues, they've also kind of taken into consideration what is most important before we're faced with this pandemic, kind of addressing these issues that are mostly pertinent to their respective countries. So there are, again, in the data, country differences based on the type of issue that each country is for example, facing. I know, for example, in South Africa, the issue of land and housing is kind of at the top when it comes to the most important problems. But also you have countries where things like education are cited by citizens as the most important problems that the government must address. And I think also one thing that we cannot leave behind is citizens' prioritizations of the SDGs, of which is something that should always form part of our conversation when we're speaking about service delivery infrastructure in Africa. So one thing I wanted to also tie into is citizens' prioritizations of the Sustainable Development Goals, and I feel like that is something that we cannot leave out when we're challenging these conversations. They already need to be at the center of the discussions. For me, in us sustaining the work that's being done by current government, we also need to bring that into place as well. For example, in Africa, across 34 countries that's been surveyed by the Afrobarometer, 57% of the people actually have noted SDG 8, which is again decent work and an economic growth, as one of the most important and critical SDG that the government needs to address. Zero hunger. So things followed by zero hunger, which is SDG 2, and SDG 3, which is good health and well-being. Those are the top three that currently in policies that government are currently acting on, they've made top of approach or even top priority, because this is what's being noted by the ordinary African citizens. I definitely think that in sustaining this, we should also still have this at the top of governments, or even those who make policies need to always keep this in mind and not act because of what is being, I don't know how to put this, but also I think it should act out of what the citizens are requiring based on their needs, because it's not a copy-paste approach. Each country has a different scenario, and they should act depending on what's coming out of each country.
Thank you very much, Google. And I think that is a very interesting point to bring in Tessa Dooms. Tessa is the director of Jashiro Consulting, based in South Africa, and she will be sharing her perspectives with us on the broader economic implication of what we're saying and what we should be looking at going forward. Tessa, share your perspectives with us on what you consider as a likely fundamental change that needs to happen within the African economic system. We've seen pressures from all sides, and COVID-19 is going to bring additional pressures, not just on the economic front, but political as well. But how do we make sure that these, in a way, as we navigate through this current challenge, that our economic system protects the vulnerable and ensures inclusivity and sustainability going forward? Your thoughts on this, Tessa Dunes?
Hi, thanks, Ibrahim, and thank you to everybody who's on the call. So I'll put my contributions into three buckets: economic structures, the informal economy, and then the question around social welfare and the role that it plays, and I believe plays, in any economic system, but particularly ones in developing contexts. So in terms of economic structures, and maybe before I even say this, I think the part that Google raised that I want to latch onto almost immediately is this idea that when we're responding to this crisis, we're responding to this crisis in light of ongoing crises in our countries and on the continent that we've not been dealing with. So unemployment, particularly youth unemployment, is one of those big ongoing crises that we've left latent because we could, because it wasn't showing us death up front. So because it was something that the impact of isn't stark, we got to shift it to the side and not deal with it adequately. And we're now seeing the implications of not dealing with crises as crisis in the long term, because now it's coming head on with something that can kill people. And that's something I think at a governance level we need to be aware of, and as a generation of leaders ourselves and as lobbyists to our governments, say that we cannot have governments that operate on the basis that they just allow economic crisis and they allow things to carry on and fester, crisis to fester, until they're absolutely forced to act. Because in terms of the economy, and particularly the structures of our economy, we've just been inactive in so many ways. So I want to raise about three things when it comes to the structures of economies. The first is localization. And I saw one of the questions earlier, or comments earlier, about this is as an opportunity when the world is starting to shut its borders and close down opportunities of travel and all sorts of things. It forces us to look within ourselves, within our countries, and ask, what are we able to do for ourselves? And if we are, as countries, and even if we extend it to as regional communities, southern, the Eastern Bloc, the Western Bloc of Africa, and then Africa as a whole, if we are just looking at ourselves and we're unable to meet our basic fundamental economic needs and rights, that is a danger to our societies. That's a danger to our development projects. And so we must ask, what are our manufacturing capacities for our most basic things, like food, like basic health and other sanitary products, like the PPEs that we've now been talking about in the health sector. But if we cannot do the basics for ourselves and for our people, we are putting ourselves at a high level of risk, especially when we are doing that in the context of a world where other people's buying power for those things they cannot do for themselves is higher than our own. So we've got two challenges if we don't address localization of our economies. Is that one, we won't be able to supply for ourselves, but two, we don't have the kind of buying power that means at a moment's notice we can mass purchase from somebody else the things that meet our basic needs. And as we know, the age-old issue around Africa and African economies is that we export raw materials and then we buy those things back as secondary produced materials at higher costs already. And that's something we need to revisit and rethink now more than ever. But also the African continental free trade area is really providing us with an interesting opportunity around what localization looks like and what localization means. Essentially, we are, by creating this instrument, we're creating one of the largest trading blocks in the world, one of the largest connected economic blocks in the world. And we need to think about how we harness that between ourselves as countries, how we harness that within our countries, how we harness that regionally, so that we become more and more self-sufficient, both in terms of our economic needs, but also in terms of our competitiveness with the rest of the world. The second area around this is the question about what do you localize to? And so I think our manufacturing sectors, we certainly need to think about what we're manufacturing and what we should be manufacturing ourselves. We should be thinking, I think, about ITC, and we've spoken a bit about that already today in this conversation, so I won't labor it, but I just wanted to point out that issue around connectivity and the cost of connectivity. If we don't address how we participate in the connectivity value chain, so for example, a company like Facebook plans to do a lot of connectivity infrastructure building on the continent. And that's going to mean job creation for the people who are going to be laying the cables. Something just as simple as that. But if it's going to be external actors outside of our countries and continents that drive something like connectivity and the ICT space that's going to grow exponentially over the next few decades, then we lose out on the economic opportunities and our own ownership in those value chains. So we do need to think about ITC beyond just creating of apps, but also in terms of the full value chain of ITC and how we become much more substantial players, especially when it comes to our human capital, which I'll get to in a moment. Of course, service industries are important, but the final thing that I think is really important is infrastructure builds. And this links also to what Gugu was saying earlier about the healthcare system and the need for us to build and develop our healthcare system. We have many big infrastructure build needs on the continent. And the one thing we know about infrastructure is that AI is not going to displace the jobs that infrastructure can create. It's not going to displace it soon, at least. So there are many jobs that sit within the infrastructure space, and our social infrastructure needs help. It needs to be developed, and it needs to be done pretty soon. And if we have governments who are committed to actually using this developmental moment, I think that that's one of the largest areas that we will see some growth. And then the last thing is to think about what our global competitive advantage is. And beyond minerals, beyond resources, beyond goods, one of our greatest competitive advantages, and this is where young people come in most, is that we have human beings, and we've got young, economically active, or at least working age people that can do work. And the thing about COVID that is really, for me, been ironic, given the moment in history in which it happens, is that if you asked African governments at the beginning of January, what is the biggest thing that you think is going to happen in the economy in the next 5 years? Everybody would be talking about artificial intelligence and the ways in which that's going to displace work. And I think that this moment has taught us that while AI will displace work in some version of the near future, right now, human beings are still the main way to create economic value. It is human beings, human value, human effort that creates economic value. And when you don't have humans in the process to make things or to consume things, the entire economy collapses. Your human beings are the central cog to your economy. Value humans, not just this economy in an abstract way. And Africa has an advantage of a young generation of people who are in this bulge at the moment, this demographic dividend, where we really can say we have a workforce that can add value to our own context and to the rest of the globe. The second issue I want to deal with is around the informal economy. And just to make two important points. I think that we have seen that the value of the informal economy to our broader economic systems in Africa, and that we really cannot actually continue to pretend like the informal economy is some marginal part of our economy and that we only care to formalize them. I often talk about in the South African context how the Mbeki presidency, I think, was incorrect in their view that the informal economy must be formalized in order to have value. I believe in Africa particularly, in many places in the world, the informal economy has intrinsic value of its own. And that formalization is often not only just difficult for informal traders or people who work in the informal economy, but sometimes it's detrimental to their economic models and the business models that they have. And so I think we need to think about how we start valuing the informal economy differently without just a push towards formalization. And I think there are a few ways we can do that we've already seen some examples of. One of them is agriculture and food security. I think we need to disabuse ourselves of the idea that food security can only come through formalization. I think we can see great value in subsistence farming. We can see great value in small-scale farming that looks at particular geographies and particular communities in terms of food security. And we can really think about how you grow. And this is really my view about the informal economy, is that you don't force people to formalize, you grow them into formality. Because every business person knows the greater your business is, the bigger your business becomes, the more formal instruments are helpful. But while you're still a small business, those formal instruments can be harmful. And so really what we want to do is we want to grow businesses into formalization through nurturing the informal economy. So agriculture, I think there are opportunities, crafts, there are opportunities. Things like M-Pesa have taught us about how you can value and support the informal economy. So if I think about M-Pesa in East Africa, one of the things that it's done is it's made it easier for people to buy from their local corner store without needing access to actual hard cash. That is a support to the informal economy. And so the informal economy needs, I think, three things in order for it to be more successful than it is now and to really become a place, even through these times of COVID, and I think almost especially in these times where you want people to buy local and you want them to buy as close as home as possible and not congregate at big supermarkets, is that you want to create ways that skill people in the informal economy with business acumen. You want to create infrastructure like marketplaces. South Africa is one of the weirdest countries for me on the continent because there's so many rural villages and peri-urban settlements that have no market, that have no local market where people can trade and where the only place they can get their groceries done is a big supermarket or mall. And I think that's an infrastructure issue that can be addressed. And then finally, the question of market access. And I think, again, COVID-19 has shown us in South Africa, when we first came up with our relief plan and our essential services list had no place for informal traders. And within a week, we saw the disaster that caused, because it meant that people could not procure things locally. And it meant that an entire part of the economy came to a halt and we couldn't afford it. And we changed that within a week. So market access is, I think, really important. And then there are opportunities for funding models as well. And I won't go into that much, but I encourage people to look at something called the People's Fund. And it is taking what we would think about as traditional savings plans and savings stokvels. I can't think of the non-colloquialism for it, but savings groups, and really scaling it up in a way that it can fund small businesses and informal settlement, or informal economy, sorry. And then the last thing I wanted to point out is the question around the social aspects of this and social welfare and social economy. And I think there's just 2 points I want to make here. One is we need to have a serious debate on the continent about a universal basic income grant and really push back against narratives that the only people who are worth support in our economy are those who pay tax through formalized work. Because we also know that many of our citizens are paying tax through their consumption, but also the point of tax is not for the taxpayer to benefit. The point of tax is for all of society to benefit, especially the most vulnerable, so it lifts them out of poverty into economic opportunities. And so the universal basic income grant is, I think, a social protection conversation that we must have about keeping people out of poverty and giving them opportunities to be more economically active. And then finally, the social economy. And I'm not going to spend a lot of time on this because I think Google spoke to it in a lot of ways already. That really at this time, we have so many social issues that we need to work on, that the most work and the greatest job opportunities are in the social sectors. They are in health. And a big example in terms of health, Gauteng, which is the most populous province in South Africa, has in 1 week hired 8,000 contact tracers. And being a contact tracer does not require a high level of skill. So it's a very short term in terms of training and upskilling that needs to be done. But here you have 8,000 young people who have a job that they didn't have a week before, and it wasn't even a job opportunity 2 months ago that they would have considered. That is a social economy job. If you think about what needs to happen in terms of food security, we've never had as many food security initiatives come from the social sector in our country as we've had in the last 2 months. There are jobs in the social relief sector that need to be harnessed. Education. I've been saying to people, as we try to deal with the impacts that this is going to have on education, one of the biggest opportunities is getting teacher assistants and getting more and more young people who have graduated or young people who have finished school to be trained as teacher assistants so that we can help our education system recover from whatever time that it's losing through the lockdown. So there's just a big opportunity in the social sector that we need to harness. My parting shot is this, is that we don't have the luxury of long lockdown periods as countries that haven't got the infrastructure and the crisis management before COVID-19 to be able to absorb the shocks. And so we need to get back into the groove of our economy as soon as possible. But it's going to be contingent on two things. One is to do a social compact around safety and the lives of people being paramount. And number two is having economic actors, particularly companies, that are not going to put profits before people. And that both is about their health and about not having exploitative labor practices. Because a lot of what we are dealing with now is a result of inequality, not just poverty. Thank you.
Thank you very much, Tessa, on those important, poignant points that you've made, particularly around investments and people. How do we enhance or, sort of broaden the conversation on the continent on investing in people, education, health, but also the very important point you made about localization of the economy, particularly that we're beginning to see some sort of nationalization policies globally around economies, of course, led by the United States, but also that, COVID-19 sort of created a panic that then made so many governments across the world sort of, shut everything out and begin to look inside. Now, one thing I wanted to reflect on, would be actually two things. One is, what would you say to people who say, we do not have these resources for a universal basic income grant? We do not have these resources, and this is also to Google. We do not have the resources for a universal health insurance, particularly with the way our economy is structured now. What is the way forward? How do we address that? For me, that's the first question. The second one is likely for me, the fundamental point you made about the way to grow the informal economy, or the way to strengthen and help people transition from the informal economy, is to grow the informal economy so that these guys grow into formality. Are there examples on the continent that you would want to, sort of highlight, to sort of do some comparative analysis of what could be the policy formula for that to happen on a large scale? There has been quite a few questions, and it's good that you've answered quite a number of them in your intervention. But to Google, there were quite a few in terms of the universal health insurance. I already touched on that. There's also the element that Rizan was talking about in terms of health not just being a service, but a fundamental right, and something that we need to begin to look at from a human rights point of view. There's also the question to Google on the point around everywhere now, everybody's focusing on COVID. So even the joke is that those of us who don't have COVID yet should not fall sick at all, because there is nobody to attend to us. Everybody's focusing on COVID. What should we be doing to sustain sexual and reproductive health services like contraception and abortion services for people, but also malaria, tuberculosis, and all of those issues as well. We also have questions around, what sort of smart partnership would you suggest to promote social justice among Africans and encourage productivity and competitiveness? That is to you, Tessa. So it's largely around, how do we look at this from a social justice point of view? And I think it's the point you're making about the universal grant per se. So I would allow you and Google, but Google will go first to sort of reflect on these questions. Google, you have the floor.
Hi, thank you so much for the questions. I think more than anything, some of them were, I've just browsed through them, more than anything, some of them were comments. But I think also it is a discussion that we need to have in our respective countries in regards to healthcare being a basic human right. Again, as I mentioned, I think one thing that the approach that government needs to start looking at is the approach of inclusion and the approach of making sure that those who are most impacted in these respective economies or even countries are included in these discussions, or rather even in making these policies, because 90% of the time we find that government creates policies that are not necessarily being implemented in respective countries because they haven't included the various important stakeholders in creating those policies. So for me, the conversation of inclusion is something that we need to speak more about in Africa when it comes to creating such policies that even tackle issues of healthcare services and even other various social justice issues that we face in the continent. So I think that kind of wraps it up.
Thank you. Excellent points. Tessa, your response.
Yeah, so your first question, Abraham, we don't have the money. That's a really, really hard one for me to accept. We have countries like mine where the scale of corruption is so high that to say that governments don't have access to money just feels like an outright lie. And so the question isn't, do we have access to money? The question is, do we trust our governments to use our money properly? And that's where the rubber hits the road, is that if I'm an entrepreneur and I want to create value, am I willing to give over my tax to the government and willing to trust them with that tax so that we can create those social protections? The other question for me is, can we afford not to? And the truth is we can't. COVID-19, amongst many other crises that we are facing in our country, shows us that we actually can't afford to lose the money we're losing to things like corruption and to things like capital flight, and not protect the most vulnerable people in your society who are supposed to be the economic players driving more value. And then the controversial thing that I'll say is, there's never been in our lifetime a more interesting moment to engage with the big development finance agencies. Because right now, Africa is not the only one that has got a begging bowl. There are developed countries that are going to have begging bowls for the next year or two. And that means that the IMF, the World Bank, all sorts of agencies are going to have to be much more lenient about the way they structure deals. So I'm not calling for structural adjustment programs to return. Please hear me. What I am calling for is to look at harnessing this moment where the whole world is in the same or similar positions to structure deals that are beneficial to us based on our claims of the value that we can add. And I would particularly say that the African Development Bank has a particular opportunity right now to become the kind of international money lending agency that really can have a developmental outcome if it plays its cards right. So it's not about whether we have the money now, it's that as money becomes available in the next 3 months, 6 months in our countries, will we use it in the right places? To deal with the question about the informal economy and where this has worked, one is the arts sector. And actually maybe this is something I can pin down to a few examples. But the arts sector started off as an informal sector in many African countries, where you had singing, dancing, troupes, all of those kinds of things informalized. Today we have Nollywood. You've seen how that sector, structured and supported, can grow into one that creates jobs. And so even if you thought about other kinds of arts, if you think about the jewelry, the arts and crafts business, we are more and more seeing formalized arts and crafts boutiques rather than only the mothers selling on the side of the roads. What it takes is just a little bit of innovation and thought in terms of how do we scale this up? How do we start production lines? How do we use the internet? How do we use different mechanisms to add more value to those sectors? So I think those would be some of the examples where you can see how scale up and market access can make a vast difference. And then the last thing around social justice. I think there are two things around social justice that are important. The one is the question about a social compact on inequality. And Africa for all, and I live in the country that's the most unequal in the world by every standard. And so I say this with that level of conviction, is that in our countries, we cannot allow that we have these elites, particularly politically generated elites, that are growing and growing and growing in our countries at the expense of the poor. And so we need a new social compact around wealth creation and elites, and the ways in which they will reinvest into our economies so that we can protect the most vulnerable. And the second part of that is around basic wages and our minimum wage policies. If you're not going to create safety nets in terms of social welfare, you have to at least create economic safety nets, like a basic wage that allows people not to be exploited when they actually do give their labor. So those are two opportunities, I think, that are social justice focused, that we can have collective efforts around and policy efforts around.
Well, I mean, we can continue on and on about this and we would never finish, because again, this goes to the heart of the fundamental challenges that Africa grapples with at the moment, not just because of COVID. And I think one of our speakers did speak about it earlier, that COVID hasn't really impacted us heavily in a way that the sort of revolutionary change that we often call for, we should expect to see it. However, I think that the dent that it has already caused for many of the economies, our social and political structures, should in a way create an opportunity to begin to have these very fundamental conversations about where our continent goes to. And one important point, and this is the point where I bring in Faten Agat back to the conversation. One important point, or that question or comment that a lot of people have made on the chat room is, what should the African Union as a continental body be talking about? What should it be leading on? What should it be bringing our governments together to, to say this is the common African position? And I know that there has been a lot of research studies and reports that have been released over the last few months from the African Union by various organs and the Union and the Commission in itself in Addis. However, what should be the three, if we can narrow down, or maybe 4 or maybe 5, take the number, whatever suits you, that the African Union should be leading on? Faten, your thoughts on this?
Thank you, Ibrahim. I think they're both in and I would say medium-term type of roles that the Commission the African Union, I'd say, and with all its its different tentacles can play. I think immediately there's certain concerns around, for instance, having access to testing. We're pretty much locked out of that game at the moment as a continent. And even the Africa CDC has been complaining that even when countries have money, it's been very difficult to have access to testing when basically tests are bought on the tarmac in, be it in China or elsewhere, after being, bought on the tarmac literally by countries such as the US. So I think facilitating that joint access for the whole continent instead of every single, I know some of our countries think they're big enough to be able to lead all of this by themselves. The truth is that not a single African country is big enough to weather this by themselves. So I think the AU can provide that platform, and I think when it needs to be efficient in the way it does it, obviously. I think also in terms of easing some of the immediate pressure in terms of debt repayments, etc. But I think that's being done at the moment. I think the key challenge is really in the medium term to bring back, in fact, some of the discussions that we started, with the launch of the African Union, the issue of socioeconomic rights that has been a bit swept under the carpet, in the name of economic prosperity. I think what the situation shows us is that the country is as vulnerable as its socioeconomic systems are. And I think what we have seen across the continent, that even the most, the countries with the highest economic growth, or the countries that are, in fact, the countries that are most affected on the continent are the most industrialized 5 at the moment. So I think your economic prosperity will not make you immune. It's really going back to that discussion of socioeconomic rights, and I think the AU does have a role there in doing it. The second point on this front, maybe my last one, is to say that I think there is space for us collectively as a continent, and I think the AU does provide this platform to open a very serious discussion on economic models, and particularly, I really enjoyed Tessa's intervention on the informal sector. I think it's delusional to believe that we can formalize the African that we can formalize an entire sector, not a small sector, it's a gigantic sector on the continent. And so I think bringing in the different minds to be able to think of an African agenda, an agenda that is appropriate for African realities, that's appropriate for the size of our informal system, that appropriately responds to our poverty challenges, is what is really needed. And I think moving beyond the type of, I would say, mimicking strategies that we've seen work elsewhere, but really providing a platform to think about what would work for Africa, I think the AU can potentially play that role.
Thank you very much, Faten. And I think that is a very good point to wrap up this conversation, at least from my side, before I hand over to Yiaga Africa. I think that what has been a common thread across the 4 themes that we focused on today is the need for a lot of reflection on how Africa grapples with, the reforms that are imminent post-COVID-19. There are challenges, there are pressures in our political and governance space. There are challenges and vulnerabilities in our social sector. There are challenges and a whole lot of pressure on our economic system and sector broadly. And we need to begin to have, like Faten did say in our closing remarks now, that we need a serious conversation, not just at the African Union level, but across the continent, at the regional economic community level, at our national level, to begin to question how inclusive are these systems politically, economically, and socially, and how do they ensure that citizens have their space to impact on policy development and implementation, but also help to ensure accountable and responsive governance on the continent. It's been an honor to moderate this session, and I really thank our four speakers for a very brilliant input that they've provided to all of us and to the over 50 participants that we've had all through this conversation.
Thank you, Ibrahim, for moderating the session, and thanks to our speakers, Fatin, Tessa, Gugu, and I think Tijani is out. Bosu, yeah, I think he's not with us at the moment, but it's really been an interesting and engaging conversation. For Yiaga Africa and for Civic Futures Initiative Africa, our goal is to continually work together to promote and support sustainable democracy and development, and basically to start identifying how we have African solutions, or Africans defining their own future, and especially for young Africans to take that leadership. I can see in the comments some questions asked about the videos from this recording and what next from this conversation. We have this recorded already. I'll be sharing the links to those who couldn't join in. In addition, this is part of our civic leadership series. The goal is to start investing in that strategic thinking within African youth and investing in knowledge production on how we can define to chart our path for the future. From this conversation, we also would be having paper series produced from this conversation, just highlighting the topics discussed. Would plan for future webinars, but the idea is to also document and to have this knowledge provided for individuals and for policymakers and for activists and for entrepreneurs to use as that document to engage and to work together. I think something Faten said about our country, our continent is as vulnerable as our socio-economic system is very critical, because COVID has revealed how vulnerable and fragile our systems are, and the need for us to start engaging government at the highest level and engaging citizens at the lowest level, and to see how we work together to respond to African problems with African solutions and homegrown ideas. Once again, on behalf of the partners, we thank you. We thank all our participants for signing in. We're happy to see over 53 members joining. We have people also trying to join in at this moment at the end of the session. We especially appreciate our speakers. Please, you can follow the conversations on Twitter, Civic Futures on Twitter, and Yiaga Africa on Twitter. We'll be sharing tweets from this session, but we'll also be uploading the links for that. After this session, we'll be sharing an evaluation form to every participant to help us evaluate this, so we can see how we can plan better webinars in the future. Once again, thank you, and let's remain great people of Africa.
How much of our response in terms of leveraging technology and innovation
within the space of less than 2 months?
What is that likely to mean for the continent going forward?
The continent remains one of the least infected continents.
Africa needs a focus on a care that is accessible to all, integrated, appropriately financed, flexible, and also technologically enabled and sustainable.